Okay, it's called medical chart review. How do you handle those requests when they're
I can't answer that. You have to talk to an attorney.
No, you don't understand my question. I'm not calling the your office for legal advice. I'm calling as a prospect.
If for medical review, we have to hand in our notes.
Now you're talking actually copying, not on-site, right?
If we are requested for in medical review, they request us. Yeah, we have to give them our notes. That's the law.
So when a patient asks if things are confidential,
they're confidential, but not for Medicare. When you sign up for Medicare, there's something there that says that they have the right to look at your records.
Well, I can assure you there isn't.
Well, listen, I'm not going to debate it with you.
I understand, but here's my question.
Yeah.
When a consumer asks if things behind closed doors are confidential, what do you tell them?
I tell them they're confidential.
You don't tell them about Medicare?
No. Listen, I'm not going to discuss this with you. If you're interested in coming in, I can refer you to the director. However,
who's the director's name?
The director. However, I will tell you that the director will tell you the same thing. If Medicare requires our notes, we have to send them.
Records?
No valencia.
Yeah, we would send whatever they're asking for.
Well, they usually are very broad, so they ask for quality insurance. So look for
everything.
Yeah, ICD-9 codes. Mm-hmm. Now, you provide therapy, social working type of program.
Whatever's in the chart.
So then the question is, does the therapist separate the conversation content from the chart?
No.
Okay. So it's included, right?
Yeah, it's part of the chart.
Do you title them as progress notes?
I'm sorry, do we what?
Title them as progress notes?
Yeah, it's under progress notes.
Okay. Do you keep any other therapy notes other than progress notes?
Whatever, if you were in, it depends. Whatever you had done in the hospital is documented in the chart.
Oh, you're kind of in the hospital thing. All right. Now, the reason why is psychotherapy notes are considered conversations of a counseling session and are separated from the rest of the medical records. So is there any of those scenarios that happens in your hospital? Apparently, it's a hospital. You're a hospital? You're not a group provider?
No, this is Princeton Hospital.
It says Princeton House Behavioral Health Care.
They're one of, it's an entity, but this is the actual hospital. You didn't call it Princeton now.
And they're outpatient, the behavioral health care part?
It's an outpatient, yeah.
So do you handle their paperwork?
Yes.
Okay. So, all right, I'm trying to place everything. I don't know the layout, but if you handle their paperwork, then their therapist writing the notes, could they have separated, or do you believe that they're just part of progress?
It's part of the medical record.
Let's see. All right. Naturally, they would get those, right?
Right.
All right. So sometimes the insurance companies get the... have you seen a case where Aetna, just Medicare, Aetna and Blue Cross Blue Shield, do you see them asking for quality insurance review requests?
Yes.
The same way as BA?
They all do. Mm-hmm.
Interesting. All right, I got to note that down.